Welcome to the deep dive. Today we are jumping straight into one of the most structurally complex issues facing, well, every nation on Earth, the limits of global healthcare.
That's right.
Our source material for this provides a fascinating, almost non-emotional analysis using a framework they call Global Operating Architecture, or GOA.
Exactly. And, when we look at headlines about hospital funding crises or drug shortages, we often focus on the politics.
Of course.
The GOA method flips that. It insists we analyze this crisis purely through physics and structure. Think pressure, friction, velocity mismatch.
So we're not judging policy here.
Not at all. We're just mapping the underlying structural loads.
Okay, so what is the central diagnosis that emerges when you look at healthcare this way?
Well, the central thesis is it's pretty stark.
Go on.
Healthcare is structurally no longer a sustainable, market-maintained industry.
Okay, that's a big statement.
It is. But this isn't about a political failure. It's a failure of, let's call it, economic geometry. The system's extreme technological advancement, combined with the predictable, immutable force of global demographic aging.
It's just too much.
It's simply exceeding the core capacity of national operating systems. Everywhere. The structural pressure is mounting globally, whether you live in Tokyo or Turin.
Right. So let's unpack this for you, the listener. Our mission today is to use two main GOA concepts. The first is membrane tension index, or MTI.
And the second is speed mismatch, which the analysis calls shear.
Exactly. We're going to use these to map the global pressure points. It's time to build our structural map of the world's systemic heat.
To start, we have to properly define what we mean by the healthcare OS.
Right, the operating system.
It's the totality of institutional, financial, and technical infrastructure a nation uses to maintain health. It's an OS, a foundation layer that everything else runs on. It's not just a simple commercial service.
And the big question is, why is this system, which for decades has been run as a kind of hybrid model, part state, part private market, why is it suddenly becoming so unstable?
It's because of one fundamental structural limit, and that's the rapid and I'd say irreversible shrinkage of the market sustainable area.
The market sustainable area, what does that mean in practice?
Well, think about the investment cycle. Specialization, astronomical equipment costs,
Yeah.
like a cutting-edge MRI or a surgical robot.
Things that cost millions.
Millions.
Yeah.
And then you have the sheer volume of high-need, low-return patients,
Yeah.
namely aging populations. All of this makes running an advanced healthcare system inherently unprofitable.
Can you ground that a bit more? What makes a modern hospital financially unsustainable if it's relying on market forces?
Sure. So 20 years ago, specialized equipment might have cost a few $100,000 and lasted a decade.
Okay.
Now, advanced diagnostic tools can cost millions, become obsolete in 5 years, and they require hyper-specialized maintenance. In a true market, these costs would be passed to the patient.
Which would make the care completely inaccessible for most people.
Precisely. And since society demands access, governments have to subsidize it. But those subsidies, they only delay the inevitable. The system forces its own redefinition from a service industry into necessary social infrastructure, a permanent deficit center.
Which brings us to the visible consequence. You cite mass hospital closures and salary non-payment in places like China.
Exactly. Those visible failures aren't just isolated political mistakes. They are the direct symbol of this structural contraction. China, in this analysis, really shows what happens when the economic costs simply outpace the national ability to sustain that market component.
Let's look at that global map of static pressure then, using the first key tool, membrane tension index, or MTI.
Right.
This measures the accumulated static pressure on a national operating system before it breaks. It goes from level 1, which is stable, up to level 5, which is rupture.
And as you just noted, China is the MT5. It's the visible catastrophic rupture point.
But the analysis says we should pay just as much attention to the high-pressure, quiet regions.
That's the key insight. Take Japan and the European Union. These are fascinating because the pressure is accumulating silently.
So Japan is ranked MT3 high tension, and the EU is MT4, which is critical. What does that pressure actually look like on the ground in those places?
For Japan at MT3, the pressure comes from two specific factors. First, an exceptionally aged population putting maximum demand on the system.
Makes sense.
And second, an extreme import dependency for high-value raw materials, specific APIs, active pharmaceutical ingredients, and advanced technical staff. They have the money, but they don't control the inputs or the workforce.
And the EU at MT4, why is it rated even higher at critical?
The European Union faces a broader fiscal weakening across multiple member states. This makes debt management problematic. And you combine that with chronic cross-border supply shortages.
So when national budgets are already stretched to the limit supporting this deficit-running infrastructure,
Any external shock, like a drug manufacturing pause in India or China, immediately pushes them toward that critical threshold.
wait a minute, before we move on, I have to ask about the U.S. It's categorized as MT2, moderate tension.
It is.
That placement seems to contradict, well, every news report we read about healthcare costs and lack of universal coverage in America. If the system leaves millions uninsured and costs twice as much, how can it possibly be at a lower tension level than Japan or the EU?
This is a great point, and it's where the GOA structural lens becomes really useful. The U.S. is presented as a structural exception, not as a successful model.
An exception how?
While it has profound problems with access and cost, which are clearly failures, the sheer volume of its market size and its unparalleled capacity to absorb capital acts as a massive buffer. It prevents a systemic rupture.
So the U.S. dissipates pressure differently.
Precisely. The U.S. generates and consumes its own advanced medical devices, its own new drugs, the S4 technologies we'll get to in a moment. It's a supply-side superpower.
I see.
This allows the system to release pressure externally through innovation and profit, rather than letting the pressure build up internally until the entire structure fails, which is what we see in MT5 regions.
So the problem shifts from the system is failing to the system is functional, but the price is too high and access is unequal.
And structurally, that difference matters a great deal for stability.
That distinction changes everything. Okay, if static pressure is building, we need to talk about why the conversation about this pressure is stalling. The analysis calls it calcification.
Yes. In nations like Japan and the EU, we see calcification. This is where discussion of the underlying structural problem becomes silent or just gets stuck, even as the fiscal pressure increases.
It's like a boiler where the pressure gauge has rusted shut.
That's a perfect analogy. The pressure continues to rise, but the ability of the political and media system to acknowledge or respond to it has frozen. This phenomenon is a clear sign of structural paralysis.
Okay, we've mapped the static pressure with MTI. Now let's zoom inside the system and analyze the source of dynamic friction. The analysis calls this shear. What is it?
Shear is generated by the difference in speeds between the four major operating layers within the medical OS. We define them from S1, which is slow, to S4, which is ultra-fast.
Walk us through the extremes. What's S4?
At the top end, you have S4, ultra-fast. This moves in days to months. This is AI diagnostics, generative medical tech, personalized gene therapies, capital investment flow. It's rapid, agile, and technologically explosive.
And at the other extreme, S1.
S1, slow. This moves over decades, 10 to 30 years. This includes culture, public values toward health, and critically, the deep structure of the state OS itself.
Things like medical licensing rules, malpractice law.
Exactly. Or even just the time it takes to train geriatric specialists. That's all S1.
So where is the maximum frictional heat being generated? What's the core finding?
The primary frictional heat comes from the maximum speed mismatch between S4, the technology OS, and S1, the demographics and cultural OS.
Technology is accelerating, promising incredible longevity and innovation.
But the institutional and cultural frameworks, S1, are stuck managing an aging population with legal structures that might date back to the 1980s.
It's like trying to regulate TikTok using the rules for a rotary phone.
That's it. That's the scissors effect right there. The cost structure of S4 tech is just incompatible with the slow adaptation speed of S1 institutions. This velocity difference is what precipitates those visible failures we talked about. It forces the system to either break, which is MT5, or rely on massive, fiscally weakening subsidies, which is MT4.
Okay, we've mapped the friction inside the system. Let's zoom back out and look at how that friction affects global resource flows. Why does healthcare finance escalate from a national budgeting headache to a geopolitical national survival strategy issue?
Because of that structural necessity we discussed earlier. Healthcare now has to run at a loss.
Right.
Therefore, where the massive subsidy money goes becomes a strategic issue. The analysis identifies two possible outcomes for the vast sums poured into hospitals and social care.
Okay, what are they?
Outcome 1. The money circulates internally. It stabilizes domestic industry funding, local medical device manufacturing, domestic pharma research, local supply chains.
And outcome 2?
The money flows out immediately to overseas corporations and foreign supply chains.
And that second scenario creates a major vulnerability.
A profound one. It leads directly to what the analysis calls supply chain geopolitics. When the production of essential items, whether it's raw APIs, specialized devices, or even vaccines, is concentrated in specific, sometimes rival countries.
It forms a resource gradient.
A resource gradient,
Yep.
yes. And that concentration is a key vulnerability.
So those nations we identified as MT3 and MT4 Japan and the EU, they're not just suffering from internal tension. They're actively hemorrhaging strategic national capital and are completely subject to external geopolitical pressure.
They are paying a rising external maintenance fee for their own national operating system. And the analysis views controlling the structure of that circulation, domestic versus overseas, as critical to national survival strategy.
It's about national economic security as much as it is about public health.
Absolutely.
Understanding this structure lets us look forward, not with certainty, but with assigned plausibility. What are the 3 adopted scenarios for the future of the healthcare OS under this framework?
So we project 3 main directional gradients, and we order them by their perceived likelihood.
Okay, what's the first one?
The first, and perhaps most frightening, is the hard landing, or the triage society. This scenario assumes that government simply cannot sustain the deficit, leading to a rapid, explicit shrinkage of public insurance and services.
And longevity inequality becomes formalized based purely on wealth.
That's the direct result, yes.
What's the technological optimism scenario? Is there one?
There is. That's an area too.
Ah.
The AI robotic supply revolution. This is the special case where S4 technology moves so fast and becomes so effective, think AI doctors, fully automated remote surgery,
Okay.
that it breaks through those rigid S1 legal and institutional barriers. It fundamentally solves the supply and labor cost problem. It's a true technological fix.
But the analysis assigns the highest plausibility to a third scenario.
It does. Scenario 3, stealth contraction. This is the quiet collapse.
Explain that.
Systems are formally maintained. The political narrative, the idea of universal care, is preserved. But in reality, the supply, the quality, and the access slowly degrade below the public's awareness threshold.
It's the death of the system by 1,000 quiet cuts.
Exactly. And it aligns perfectly with that calcification we noted in the high-tension regions.
Stealth contraction feels like the logical outcome of a system operating under structural paralysis. This brings us down to the individual level. If structural contraction is the most likely path forward, what's the optimal strategy for you, the listener?
Well, if the national OS is contracting, the GOA analysis introduces the concept of the personal OS exit strategy.
An exit strategy.
The core defense is simple. Proactively reduce your future medical dependency.
So it's about shifting your personal investment focus.
Absolutely. Instead of solely relying on political promises or insurance safety nets that may, stealthily contract, you invest heavily in prevention and what we call health assets.
This isn't just generic eat well advice, is it?
Not at all. It means dedicated investment in stress management, physical fitness, metabolic health, and perhaps specific diagnostic tools that allow you to manage your own risk profile.
You are essentially viewing your robust personal health as the final shelter against a long-term system failure or degradation.
Exactly. It's the ultimate de-risking strategy against systemic collapse. If the maintenance costs of the national OS are going up and the quality is going down, your goal should be to minimize your personal use of that increasingly expensive and degraded infrastructure.
Wow. This deep dive has completely reframed how we view the global healthcare crisis. We've moved past politics to map structural tension. We cover the healthcare OS failure, mapped the global membrane tension landscape from the MT5 rupture in China to the quiet MT3-4 calcification in the EU.
And we identified the core friction, the heat source, as that S4 technology speed colliding with the decades-long S1 demographic and institutional lag.
The real power of using the GOA method seems to be that we shift from judging facts as good or bad
to understanding them as heat sources and local tension sensors. The biases or emotional narratives you hear in the news are not noise. They're merely gradients showing you exactly where the pressure is concentrated on the world's structural membrane.
So a final thought for you to reflect on. Considering the visible MT5 rupture in China and the quiet, accelerating MT3-4 pressure in import-dependent nations like Japan and the EU, where on this global tension map do you think the next semi-critical point, the next moment of quasi-criticality will emerge before this global stealth contraction becomes undeniable? It's a crucial question as you apply this structural analysis to the news you read this week.